Welcome to the Capital Integrative Health Podcast, a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. I am Dr. Andrew Wong, co-founder of Capital Integrative Health, an integrative practice committed to expanding access to holistic root cause medicine to the global community. Today we are bringing you a conversation with Dr. David Hagedorn. Dr. Hagedorn is a clinical health psychologist and neuropsychology expert and a recognized leader in the clinical neuroscience field. As an international speaker and instructor for advanced psycho-neuro electrophysiology assessments and interventions, Dave has a specialized skill set in working with patients with anxiety, depression, PTSD, ADHD, and much more. Join us today for a conversation about the root causes of conditions such as anxiety, depression, ADHD, and PTSD, and what you can do to support your brain health. All right, well, welcome Dr. David Hagedorn to the podcast today, and we're so glad to have you here with us.
Pleasure to be here. Nice to talk to you.
And Dr. Hagedorn, you are an internationally known expert in clinical psychology and neuropsychology. So we just wanted to kind of start broadly first. What made you first interested in this field?
Sure. So I was doing a lot of neuropsychological testing with patients in Dallas and parts of Oklahoma. And it became apparent that after an 8-hour test battery and a 12, 15-page report, all I was able to do is tell the patient their head was not working correctly, something they knew before they walked in, and to charge $2,000 to tell them that, but not really have a good treatment plan other than, get cognitive therapy, go see your primary care doctor. It was embarrassing, frankly. I mean, I could articulate the problems with testing, but I had no solutions. And I started adding the EEG analysis to my neuropsychological testing at some point. And I realized that in 30, 45 minutes of data collection, I knew more about the brain function than in 8 hours of neuropsychological testing. And I knew how abnormal each area was, and I knew what symptoms they would have. So I could predict their symptoms just with the data from the brain. So the best part was it actually gave me targets to treat with neurofeedback, with brain stimulation, with selective use of medications, with treating underlying mechanisms like enteric nervous system problems. So it became apparent that that was most useful. And then the Department of the Navy, through a large contract company, hired me to come teach neuroscience at Camp Lejeune in the residency program. So I became an adjunct faculty for the military medical school, and I was staffed with the hospital for teaching the residency. And we brought this concept to the Navy, yet the testing would still take, 45 minutes. You would have to take a half hour, 45 minutes to analyze the data. And while it was tremendously useful with military members coming back from Fallujah with blast injury and PTSD, it still wasn't smooth enough, fast enough, automated enough to make it go to a clinical level. It was still a lab level tool. And we decided that we got to make a better mousetrap, something that would be faster, easier, automated, kind of idiot proof, frankly. And that was the genesis of the company. And I got a little bit of money from an investor out of the country, and that launched Evoke.
Right. So thank you for that answer, Dr. Hagedorn. For those that do not know, Dr. David Hagedorn is founder of the Evoke Neuroscience Company, which I believe you founded in 2009. Is that correct?
Right.
And let's talk about that for a sec. So the Evoke brain mapping, what is the Evoke test? What are some of the features of that test?
Right. So there is no such thing as really the Evoke test. Evoke's a company, but EEG analysis using quantitative methods is used worldwide. And it's been used for over 20 years worldwide and validated worldwide. So Evoke didn't create a unique test. All we did was make it more efficient, easier, and automated. So you are doing a 19-channel EEG, a 3-channel ECG for looking at the heart, And with that data, we're able to collect heart rate variability data. We're able to record all areas of the brain. We're able to look at what's called evoked potentials, which is processing speed under certain conditions that the brain is put through. So all these tests have been in existence for decades, but they've all been in labs and in research papers, and because it wasn't easy enough to put it in a clinic. So all Evoke did was take existing proven technology, simplify it, automate it, and distribute it to clinicians that would then have another tool in their toolbox.
Now, just to be clear, what is the difference between a quantitative EEG and a standard EEG that you might see from the neurology
Sure.
office?
Great question. And it's a routine EEG. So in a routine EEG, you look at, typically 19 channels, sometimes more, very infrequently less than that. And you will record it, and you're looking for morphology. Morphology is the shape of the wave, and you're looking for certain features in the wave, like spikes, certain abnormal features, which tell you you have cortical abnormality. Most EEG reports are dictated in 30 seconds. Person looks at the data very quickly, and they dictate the report. And that's useful, but they almost always say normal. Even though the brain's not normal, the patient's got tons of symptoms, the routine EEG will say normal findings. It'll say, maybe a sleepy pattern, maybe it'll say some artifact, it'll tell you about their alpha rhythm. But for the most part, they say normal when you're like, why did I even order this? Because they keep coming back normal. And I know the patient's brain is far from normal. Quantitative EEG is also just as valuable in combination with a routine EEG. But what you do is you take that person's EEG, you compare it to a normal reference group by age and gender. And then you take each frequency and you dissect each frequency out of the squiggly lines. And then you plot that in pictures and images. And you can show difference from normal across all areas of the brain. For example, if you've got frontal temporal dementia, typically you'll have frontal temporal slow EEG excessively. You'll be able to see that very clearly in a picture. A competent reviewer of EEG can see it in the morphology routine EEG as well. It's just easier to see it and put Z-scores to it when it's done quantitatively. And the other advantage is you can use something called Loretta. Loretta source localizes that abnormal EEG to what structure in the brain it's generated from. So, for example, if you have an excess amount of high alpha, say 13 hertz or 12 hertz, coming from the cuneus, you can see it generated from the cuneus. We typically see that pattern when a person's got a stress disorder like PTSD, for example. And that would start to give you an idea about what brain region is involved, for example. And it helps you then target your neurofeedback treatment deliberately and individually for that person.
Great, thank you so much. And let's still start broad with another question about, I think people that are listening here may have already done EEG or some have not, but who should be doing a quantitative EEG? Who would you consider as a clinician, as an educator, of course, in this, who would you consider for a quantitative EEG?
I think it's appropriate at the primary care level. I mean, we know neurologists use it around the country, around the world, and it expands their capability greatly. So certainly neurology is a great specialty group to do more QEEG analysis as an addition to their routine EEG. Because this is a seated at-rest condition, a sleepy pattern as well with the eyes closed. But it doesn't replace necessarily, a routine EEG. It's nice to do both. But really, people are coming in with brain problems, and it's a low-cost, non-invasive approach to get an idea of what's going on with them to help you make a better referral. So I really believe internal medicine, primary care, family medicine are really the first stop for looking at the entire body. Because before you send them off to a specialist, it's really incumbent upon the clinician to have looked at every system of the body. What's causing this? Is it hormone related? Is it low testosterone that's causing low power in the brain? Then you see that in the brain. You say, well, let's run a free T, let's run a total. Let's look at an estrone level, and see, do we have a power issue in this cell that I can remedy very quickly in my office before I'm shipping them off to neurology for cognitive impairment. So it's wise, in my view, to start with the low cost, powerful, least intrusive testing before you move them up the chain to specialists.
Primary care is often the first stop for people in their healthcare journey. And one of the things that we know is that mental health is severely undertreated and underdiagnosed, right? So we have a lot of lab work for physical health things. We check high cholesterol and screen for high blood sugar and diabetes and things like that. But how do we screen for mental health issues besides someone saying, hey, maybe I have anxiety or depression or brain fog or things like that? And one of the things that I've noticed is that the quantitative EEG really helps to uncover and even validate mental health conditions and really put it on equal footing with those physical health conditions, because we all know that both of these mental and physical health are equally important here.
Yeah, and a good analogy really is the EEG and quantitative analysis that we loosely call it as brain mapping, as a term that's thrown around, is like a lab test for the brain. When we really didn't have something like that for many, many years. People walk around with hypertension and hypercholesterol. They have no idea. They don't even know that their thyroid's off until you test it. And then it's like, wow, I can see it. It's validated. It's real. It becomes a target for treatment. And if you do things early, and look at things early, there's things you can do about it and turn the ship around the earlier you start. So I really find it incredibly valuable, as an introductory assessment for patients to start to look at what's going on in the brain housing group, what's going on up there early rather than later.
What are some of the mental health conditions that the brain mapping, we would say, can help to uncover?
Mhm. Well, we've just to start with the most acute and more recent problems we're seeing is, it's called long COVID. We've all been dealing with COVID now. 1 in 5 people who have had it are having significant cognitive problems, and we're starting to see certain areas of the brain be very slow. The frontal poles, above their eyebrows and about an inch in, that area is impaired. That affects decision making, organization, and we're seeing different abnormal patterns with long COVID that we didn't see before with other conditions. So that's, I think, going to be very useful. Plus, because we include heart rate variability data, we're able to look at the autonomic function at the same time, but which is also impacted with long haul syndrome or long COVID. So that's one reason. Anyone who's had a history of COVID now, we're like, look, let's take a look because we want to treat anything we can treat. Um, Other conditions pre-COVID years, a couple 2 years ago, PTSD, depression, because there's different subtypes of depression. There's different subtypes of ADD. It's not all dopamine receptor problems in the frontal cortex that is affected with stimulants. There are different subtypes. Some people have excess beta, even beta spindling. And for that subtype, the last thing you want to do is give them a psychostimulant with norepinephrine binding. That's contraindicated with a brain pattern like that. Yet they still meet criteria for ADHD, but I mean, they need a different treatment. So it helps us differentiate and discriminate the problem that the brain is having, not just diagnostically, but what's the functional reason for the symptom. So pretty much any cognitive related problem a person has with related to thinking, processing speed, memory, motor function, sensory function, mood, all these are brain functions. So we start there. We do not want to neglect the enteric nervous system, of course. So we don't do it in isolation of other testing like inflammation for the body, CRP, homocysteine, things like that. But it's really an important tool for most patients that are coming in with symptoms.
Thank you. And how does the brain mapping test help to uncover root causes of those conditions if it can do that?
Yeah, it's a very, very sensitive test, but the specificity is not high. So what I mean by that is it's very sensitive to subtleties, but you can't tell exactly what condition a person has from it. You get clues and you get ideas. I mean, when you get better and better at looking at it, your accuracy goes up quite a bit on what type of condition or conditions the person has. But the sensitivity is really its strength. But the specificity, it wasn't designed to pair up with an ICD-10. I mean,
Yeah.
those are symptoms. The ICD-10 and DSM-5, those are symptom categorization tools. They're not functional names or labels. So when you say you have depression, great, I can put that in the chart. You've got depression, but it doesn't tell me why. If you had a head injury from a car accident, now I know why you have depression, because you damaged the frontal lobe. So depression has a cause. The brain mapping is sensitive and helps us uncover the causes of the problem, and what subtype of depression you might have, or what subtype of anxiety or inattention or memory loss you might have. That's the value of it, really.
So I think what I hear you saying is that it's time to overthrow the tyranny of the diagnosis, time to overthrow that monarchy, maybe.
Yeah, I mean, it's a useful tool in differential diagnosis. So, trying to discern what it is. For example, when we do a workup on a person who's coming in with suspected Alzheimer's, we don't know why up front why they have that. Just because they have a terrible MoCA score, they've got cerebral shrinkage or atrophy on MRI, that doesn't tell me why. Um, and then we do more testing, and sometimes we're surprised. Most recently, we have seen a patient, without question, it's from mold. And so once in a while, and we suspected it because the brain mapping did not look like Alzheimer's. It did not have the same pattern, yet the person's cognition was really impaired. And do a more detailed history. When you see that pattern, you say it's not adding up, and you then do some additional kind of expensive mold toxicity testing, and lo and behold, it's off the chart. And then you start to put the pieces of the puzzle together. So we do use it for differential understanding as well.
Right. Like that person, like you said, with quote unquote dementia. I know we've had people that had quote unquote dementia, but it turned out to be depression. Or like you said, it
Mhm.
turned out to be mold toxicity. What is the pattern that you see on the brain mapping for mold toxicity?
Yeah, it can be one of two things. We can have very global, low power in the brain, but we also sometimes see neuroinflammatory process going on, depending on the stage or how acute the exposure might be. So we can see one of two. But it's also what we don't see. So if a person has a normal peak alpha, say at 10 hertz, their P300B is normal, it doesn't add up with a typical neurodegenerative dementia. So we're looking at it and we're thinking, okay, it's not that. It's got to be something different that's causing the impairment. So it forces us to look a little bit deeper. So sometimes it's the absence of markers that helps clue us in as well. But you mentioned pseudodementia, which is when an older adult has depression, they will present with dementia symptoms. We've all known that for decades. That's very easy to see. I mean, you see frontal low power in alpha. Sometimes it's a dominant on the left hemisphere. Very clear pattern. And then you'll see P300B very delayed, low peak alpha, like below 8 hertz, and we'll often see posterior slowing. We've seen that appears to be correlated with, say, an amyloid PET scan in a later stage. But we will see the depression component quite easily. But also, it's sometimes both. We have a person with degenerative dementia like an Alzheimer's. They will also have depression. It's not one or the other, it's both. And that helps us to treat both because we can see both on the test results and not just give them Aricept, but maybe look at treating with antidepressants as well.
Great. Thank you so much. And you mentioned before how sometimes you'll see on the brain map there's some indication on there that there could be some hormone imbalances, maybe low T, or maybe they need to, do some bioidentical hormones or whatnot, or different supplements, etc., to support that hormone axis. What is the connection? What is the interplay between the brain health, but also between brain health and also gut and hormone health? And that's a pretty broad topic there, but we know from a systems biology approach that's something that's very useful to discuss.
It honestly should be the question every clinician asks. What is the relationship between the heart and the brain, between the brain and the enteric nervous system, also called the second brain, which can function independently of the main brain? And the research is crystal clear on this. Anyone that is not treating in this manner today really needs to catch up, because the enteric nervous system is tremendously powerful in treating the brain. And it's really our first go-to area of treatment, because it has such a profound effect on cognition and brain health, to make sure the enteric system is solid. And then obviously the endocrine system, all the hormones are related to that as well. So those are also very easy with lab testing, with urine testing, blood testing, saliva. You can get a really good window into the hormone system and cycle for a person very quickly and inexpensively. So when you do a treatment in like a triad, thinking of it in terms of central nervous system, enteric nervous system, endocrine system, it's almost all patients get better. We're not really treating anymore, we're curing. A big difference. A lot of medicine is designed, unfortunately, to treat the problem of the day. And the medicine, we should, at this point in the medical history, be curing problems.
Right. So we need to go from a la carte treatments for single isolated ICD-10 diagnosis to more like systems biology treatment, CNS, enteric nervous system, endocrine system. That's great.
Well, that's how medicine was designed, first, doctor. I mean, in medical school, you first learn the biology, the cell chemistry to cure. What's the underlying reason? Somehow that gets lost in residency when you're doing 100-hour work weeks. And that seems to be the pattern, and it's very unfortunate. We need to go back to the basics.
And speaking of some of the fundamental foundational pillars of health, how does nutrition impact different brain disorders such as anxiety or depression here?
How does the system?
I'm sorry, how does nutrition and food, etc.?
Yeah, very good question. I mean, and everything you put in your body, and it wasn't really Hippocrates who said this. If people do the history, let food be your medicine. He gets credited with it, but it actually has another source. I won't go into the history of that quote, but
I love to discuss that. Yes.
Yeah, but the principle is still strong. I mean, what your body's exposed to, what water hits your body from your shower, and the amount of chlorine in it affects your body. What toxins are in your air? What plastics in your water? All of those are impacted and are changing you at a cellular level and hurting the enteric nervous system, which is a sensitive system to filter out poisons and take in good nutrients to make neurotransmitters, to improve your immune system. So all of that is happening from the day we're born. And we start to degrade because of the poisons and toxins in our system. And some people can shed those better than others. But then nutrition, of course, is part of that. If you're living a life on Big Macs, and no offense to McDonald's, but there's a lot of foods in America in particular that were designed to taste really good, but not really be good for you. There's different foods that reduce inflammation in the body, like turmeric, different types of foods, essential fatty acids from certain fishes, mackerel, for example. You're trying to undo some of the damage that happens to you every day from the exposure to a toxic world that we're in, and it has an impact on behavior. If you don't have, for example, if you don't have zinc, magnesium in your system, you're not absorbing it, how are you going to make dopamine? You need precursor nutrients in your diet just to manufacture neurotransmitters, which your brain needs to think. So we need to look at a systems approach, and nutrients is very important. What you do put in, but also what you shield yourself from by reducing the amount of toxic exposure. All of that has an aggregate benefit for brain health and body health.
I was listening to a podcast today in the morning, and I was just listening, and it kind of blew me away that chlorine is actually an antimicrobial and a gut microbiome disruptor. And so even though we're in our showers and we're probably trying to relax during that time. We're also getting exposed to chlorine, unless we have the water filters that would help that to filter that out. And then the other thing you said was about the nutrients, and I'd like you to discuss the role of fats a bit, because we know the brain's about 60% fat. Is that correct?
Just commenting on has to do with nutrition and the role of nutrition in brain health. And we know that fats are important. It's an important component. And again, that's why we have lab tests to make sure that we don't have abnormal ratio of bad cholesterol. You can look at all those things and monitor that. But we need fats in the brain, and like MCT is one of the types of fat, medium chain triglyceride, like in a coconut oil, for example, that can be very good for you when you have cognitive impairment. We always do things in measured steps. Don't go overboard with any new idea, but we monitor it against the entire body in the person's body. So essential fatty acids from fish oil, EPA, DHA has a role, nuts, avocado, more. And as we get older, our brain doesn't use glucose as efficiently. We need more ketones. It's the only two fuel sources the brain can use. And as we get older, ketones become more useful to the brain as a way of fueling it. So there's a shift towards ketotic. We call it keto realistic because to be purely ketotic is extremely difficult. People that do it, we have seen reversal of that type of severe dementia. So it can be very powerful. We know that cancers can't survive when a person is totally ketotic. So there's a lot of advantages to it, but it's not easy to do. But even being keto realistic can have a big and profound impact on cognition.
Thank you. You mean by keto realistic, keto friendly type diet with a little bit of carbohydrates? Is that?
Yeah, that's right. Not going overboard. Yeah. Because
Yeah.
there's pros and cons to that. I'm old enough to remember the days when people were having so much vitamin E to cure all ailments, and then they become toxic on vitamin E. So, we want to be wise and systemic in our thinking with these things.
Yeah. Now, what are some of the treatments that can stem from doing a brain mapping test? So they have the test, they show, and I do say to everyone also that if they're doing a test, for instance, and we see a result, no one has a perfect brain. No one has a completely green brain map. I think that's really important to say. But what are some of the treatments that can stem from having this test?
Sure. Well, first of all, I do see occasionally all grain brain maps when people are perfectly healthy. It's normal. And it's wonderful to see. Most clinicians don't see it because those patients don't come to see you. So, the healthy ones don't go see the doctor.
Yeah.
But I have the advantage of testing a lot of special operations people in the military, and they're pretty normal. They're usually very smart, et cetera. But what it does is it can guide a lot of different interventions, both on a peak performance side, but on the clinical side as well. For example, you can use the EEG data and the quantitative EEG data to select frequencies and location on the brain for things like transcranial magnetic stimulation, direct current stimulation. You can target problems very accurately now, deep within the brain, and cause it to change very quickly, even in one visit. Tinnitus, for example, ringing in the ears, is typically a central processing problem, not always an auditory system, but it's processed centrally. And we can see that clear on the EEG, and we can target that with a TMS coil and reverse it, and they'll get momentary relief when you're on target. And then this is more sustainable as you do it again and again. That's one example. Neurofeedback would be another example, where you can identify the frequency that's abnormal, the location on the brain, the surface sensor location, and train the person back. So when I mean train, neurofeedback is a training tool to change the brain. Just like learning to ride a bike, learning to play the violin, you're training the brain to rewire differently. So with neurofeedback, you're using two modalities, something called long-term potentiation, which is when neurons fire together, they wire together, causing rewiring. And then also learning theory is involved there as well. When you're rewarded, there's release of dopamine and the synaptic cleft, it's rewarding. So it's a combined mechanism of action. Very, very effective with certain conditions like ADD, certain types of head injuries, certain types of depression. It really should be first line therapy. It's that effective and it lasts. You don't have to do the treatment forever. Once you're done, you're kind of done. Like once you learn to ride a bike, you're not going to forget just because you don't ride it for a couple of years.
Right. It's an internal treatment that you're kind of teaching yourself to do as opposed to an external treatment like a medication or something like that's gonna not really be long lasting because it's not really teaching you anything in a way.
Well, there's also another benefit from it that you just kind of highlighted. You're doing it yourself. There's something inherently valuable in fixing yourself. When you can take control of a problem and you do things deliberately to improve yourself, it has another qualitative benefit that we just don't get when you take a pill. And when cases like, I mean, probably the most classic is trauma. When people are exposed to early childhood trauma, later trauma in life, that definitely changes the brain. A good friend of mine, Bessel van der Kolk, wrote a fantastic book, The Body Keeps a Score. And those people in particular, when you can give them some control back and they can learn to change their own symptoms, it's so powerful and it's long lasting.
How does trauma impact our brain function? This is a big, I think question for
Mhm.
our times for sure.
Yeah, it's a great topic. And again, I would recommend Bessel's book on that. He covers a lot of these topics. But chronic stress, for example, when you have cortisol release, when you have adrenal function overdrive, you're damaging your enteric lining for one thing. So the villi in your gut is being damaged in real time. So we know if that happens, you're eventually going to have neurotransmitter, lack of production of serotonin, et cetera. So that's one way that you're damaging your second brain from chronic stress, sleep problems. The brain, when you're traumatized, the brain does not want it to happen again. So it'll set up a pattern of processing to keep you be hyper vigilant, alert, on guard, and that high state of vigilance keeps your sympathetic branch of your autonomic system all jacked up and elevated. So you have a high sympathetic tone, which is damaging long term, damaging to your vascular system, that causes hypertension, tachycardia. So that's another aspect that your amygdala and the hippocampus in your brain are always looking for danger now to try to not let you get hurt again. So over time, and you also are producing more cortisol, and your adrenals is overactivated, and that's damaging to the cells in the brain as well to have that kind of load constantly bathing the cortex. So it's a combined perfect storm of body deterioration when a person is traumatized. When we've lectured on early childhood trauma, and you look at all the physiologic components of it, it's unsettling and insidious, but it wreaks havoc on the entire body. So the brain is just part of the area that gets damaged.
And if someone has trauma, what would you see typically, or there's certain typical patterns on an evoke scan?
Yeah, and again, we see this, others have seen this. The classic one is when a person closes their eyes from an eyes open EEG, and then they close their eyes, and they're at rest. They're just sitting down like you or I right now. The right occipital parietal part of the brain, high alpha, elevates very quickly. It's typically generated from the default mode network in the cuneus, insula areas of the brain. So it's a very classic sign that there's some hypervigilance. And it makes sense. When you close your eyes, you don't have the ability to see what's coming. Your brain is now in a heightened state of alert using your auditory system, vibrations from somebody walking in the room to try to detect if danger is coming. So when you close the eyes, the brain is trying to figure out how do I protect myself now that my sight is removed. And that's one of the reasons we're able to see it. That's one. Also, sometimes there's elevated beta 1, which is a frequency band, and 15, 16, up to 19 hertz. It gets quite elevated as well in people that are very anxious all the time, even with some OCD, obsessive compulsive traits, if it's over the anterior cingulate. So the location and the frequency tips our hand to say, wow, we got an anxiety disorder here. And it prompts us to ask questions. How many times have a patient's been in and out of the doctor's office with severe PTSD and you never knew it because they're coming in for stomach pain, for IBS, headaches, and they get treated for those things. But no one asks the question, what happened to you? And give a moment for them to cry and tell what happened. It's tragic that it happens frequently, but many cases we see that, and it's time to intervene with something like EMDR. I would do that before I put somebody on a benzodiazepine.
Trauma is at the root cause of many health issues, and I think one of the I would say goals is to first acknowledge that, identify that, and then like you said, we can treat it appropriately with things like EMDR. So there's a lot of different directions we can go here, but I just wanted to first of all just acknowledge of how helpful this conversation has been for hopefully all the listeners out there that have been kind of struggling during this time, and whether now during the pandemic or even pre-pandemic, with a lot of these mental health, brain health issues that probably, I would venture to say, for most people haven't been validated, really haven't been looked at in terms of the root cause or causes. And so the
Yeah.
brain mapping tests with the Vogue quantitative EEG can be really, really helpful for that. But let's kind of get back to some of the lifestyle recommendations. Let's say someone has brain fog, they have some brain issues. What kind of lifestyle recommendations do you recommend to help with brain health?
Yeah, a lot. I mean, again, the nutrition side is something you can do, and you can get control over that, and nobody else can do it for you. There is no prescription for this. So this one is really important. Education to know what's healthy. I mean, people still think French fries are as a form of a vegetable, so it's like, okay, we need a little bit of basic knowledge. This can go a long way. In a varied diet, making sure you don't have certain food allergies to certain things. That would be the starting point, what you can do. There's different types of exercise that are useful that the body needs, certain ways of helping improve oxygenation. Keeping your sugar level down is probably one of the single most important things, particularly in America with our crazy diet, is high A1Cs, high glucose numbers. Those are just inflammatory, vascular inflammatory condition that you can reverse. It's something that's reversible, and if you do it early, you'll keep your feet, you'll keep your legs, you won't have diabetic neuropathy, you won't have cardiovascular diseases. There's a lot you can do nutritionally and sugars is a big problem. So
I,
that would be one thing to start with, is cut those out.
I think we should rename the standard American diet the sugar added diet, SAD.
Yes, yeah, smart. I
Uh,
mean, because it will make you sad. Absolutely will make you sad.
It'll make your brain sad, inflame your brain. Sugar increases
Mhm.
inflammation. Inflammation damages the brain cells. How important is sleep in all of this with brain health? And does sleep affect the evoke on a day-to-day basis, on a test-to-test basis? If you have someone that gets 7 hours of 8 hours perfect sleep, they sleep through the night versus someone that got 4 or 5 and they're dragging the next day, how is that going to affect?
It's not going to make a big difference on the brain map results. Okay, one night of a few hours of sleep. When you have chronic deficit of sleep, like you're sleeping 3 or 4 hours over months, you're going to have such significant slowing in processing speed. The brain power processing is always slow. Your parasympathetic system will be quite elevated relative to sympathetic. You'll see a lot of deep fatigue there. What is useful, however, and we will usually use it to order a sleep study, is if you see excessive low power in the frontal poles, FP1, FP2, that will usually trigger we need to look for sleep apnea, because you can have people with sleep deficits and it's because of apnea. Their body's being woken up throughout the night because of the oxygen, carbon dioxide level in the body, and that's a problem. So we use it from a sleep standpoint, looking at possible apnea. That's one area. And then if you have overactivity, central nervous system overactivity, which is seen in a beta is very high in the parietal occipital area, that's inconsistent with sleep. You can't have a brain processing that fast or racing, and close your eyes and think you're going to drift off to sleep. So there's different tools that can help. You can train, it's called sensory motor rhythm, is from the left ear to the right. There's that stretch through the brain called the sensory motor rhythm. That could be trained with neurofeedback to improve sleep. There's a good product out of France that does that. Also, there's things like audiovisual entrainment, where you put frequencies into your eyes and ears. Product Mind Alive out of Canada is a very good one. And you can send a slow frequency pulse in that will help slow the brain down, because the brain will start, neurons will start to fire at a slower pace and calm the brain down. And I've used that with, career military snipers for 21 years who just can't sleep. The brain doesn't shut off. And this is one tool that is non-invasive. They put it on at night and can start to fall asleep. And if they wake up in the middle of the night, they just turn it on again. So there are tools to help modulate the brain non-invasively, and AVE, or audiovisual entrainment, is just one of them. And again, we use the brain map data to tell us what frequencies and what treatments might work. We kind of use that data to kind of brainstorm, what am I going to throw at this person that's going to stick? It's kind of a little bit of a cheat. It's like a cheat guide, I guess. You use a brain map to kind of cheat instead of guess.
Test, don't guess, right?
Yeah.
Do you see any differences on brain mapping between people that meditate regularly versus those that don't?
Yeah, and I'll see it. You'll see a lot of alpha rhythm. I mean, it's just off the chart, and it's like they close their eyes and they're meditators. The brain just fills up with slow alpha, and you're like, so either one of two things. I'll say either you're smoking a lot of marijuana, or you're a really good meditator, because you'll see a lot of frontal alpha from marijuana use as well. And when I see college students that are saying, "Hey, I have ADD. I need a stimulant," and I'm looking at that level of frontal alpha, I'm like, your problem for inattention is too much weed. I need to knock off the smoking. We do that first.
Cannabis. I know that some listeners will have this question, so let's talk about real quick. What are your top three? And there's probably more, but let's talk about like top three nutraceuticals that you might recommend if someone is looking for something as a little boost, a little bit of an edge for brain health.
Mm-hmm. Okay, I'm going to again go back to the second brain. You can do so much for this brain by fixing this brain.
Love that.
So let's start there. L-glutamine, vitamin C, prebiotic, probiotic, digestive enzymes, a little bit of black pepper extract to help with absorption. That combo is magical. And if you can add colostrum to it, it's fantastic. Again, colostrum is from mother's milk, early stage, or collagen, or the types of collagen for the gut. So if you were to add that combo and fix your enteric system, and in adults, it takes as much as 3 months. Kids, about 4 weeks of gut repair. You're going to do more for your brain, your central nervous system brain, than phosphatidylserine, from ginkgo, from all the things that we think about that are focused on the brain. Fix your second brain. Because then every time you put something in your mouth, the body doesn't assume it's a foreign body and needs to have a cytokine reaction against it. So you fix the enteric, you're going to fix this. That by far is the best bang for the buck.
Great. Thank you so much. A little bit of nutritional neurology here. That's great. And finally, we have some fun closing questions for all of our guests. So I just want to ask you, do you have a morning routine? And if so, do you mind sharing that with us?
No mind at all. I hear my alarm go off. I wish it didn't. That's the first phase. Feet hit the ground, coffee pot goes on. I'll try to get a shot at that combo I just told you for the gut. I'll try to throw that in a glass right away, and a little bit of water, slug it down, because you want it on an empty stomach. Okay. And then 15 minutes in before you eat anything, you've got it you've coated your system with it. It absorbs quickly before you put anything else in your mouth. So that's actually the best routine. And then, the typical get ready, go to work thing. I think most people do. Mm-hmm. Try to have a diet in the morning with protein. Protein is important to have in the morning. Your body needs some good varied protein.
Great. What book or podcast are you enjoying the most right now, and what is it about it, and why are you What is it about, and why are you enjoying it?
It's very recent. I just got it. It's called Behold Israel. And it's a person who was in the military in the Israeli army, but he's taken us through the history of what's going on in the Middle East through the biblical lens of the Old Testament and the New Testament. And it's just absolutely fascinating what's going on. What we don't get in our Western media doesn't show us. So that I really am enjoying. So yeah, Behold Israel has been pretty powerfully influential in me and how I think about the world and how I'm treating other people and trying to put their lives and their needs ahead of my own. Helps in my marriage, helps in my care of my children to think about their needs and how I can be more of a servant than being the one that needs to be served. So that for sure has really been life altering for me.
Great. That's awesome. And what do you do every day to cultivate joy?
I have joy all the time. I mean, I enjoy what I do. I don't really go to work. I go to play. I mean, helping people when they come in and they cry and they say, my mother told me I was worthless my whole life, and you're telling me I don't have these problems. I'm looking at the brain map, and they see a path towards a future health, a future benefit that they can control. It's priceless. I mean, you can't buy that kind of joy. Joy comes from doing things for others, not for yourself. Buying a new car, buying a boat, sitting on a beach does not cultivate joy. Doing things for others, that cultivates real joy.
The best advice, and that's incredible, the work that you're doing. And thank you so much again, Dr. Hagedorn, for coming on our podcast today. And how can listeners learn more about you and work with you?
I just call. Anybody who calls and has a question, I'm happy to help.
Great. Well, thank you so much for taking the time to listen today. If you enjoyed this podcast and this conversation, please take a moment to leave us a review. It helps our podcast reach more listeners, and this has been an incredibly informative talk and conversation with Dr. David Hagedorn today. So again, thank you so much, David, for being with us, and thank you so much to the listeners. And if you have any questions or comments, we'll probably be doing some sort of interactive chat at some point. But I think at this point, just leave your comments in the reviews and don't forget to subscribe so that you don't miss out on our next conversations. Have a great day, everyone.